topic we have chosen is child obesity, and the topic we're going to talk about is physical. Child obesity is a major concern, especially due to its impact on physical and psychological development. The increasing prevalence of childhood obesity is introducing health problems that were once primarily seen in adults. This issue affects children's bodies and minds, putting them at higher risk for diseases like pediatric hypertension, diabetes mellitus, and coronary heart disease. Physically, excess body fat can strain organs and cause long-term damage. Children who are obese are more likely to remain obese into adulthood. High blood pressure is also another concern that can develop in obese children, further contributing to the risk of heart disease. The psychological effects are also alarming. Low self-esteem can arise due to societal pressure and difficulties in relationship, leading to further issues like depression, eating disorder, anorexia, and bulimia. Finally, preventing childhood obesity requires lifestyle changes and encouraging regular physical activity and promoting a balanced, nutritious diet are the key strategies. Early intervention can greatly improve a child's physical development and overall well-being, reducing the risk of long-term health issues. Move to the next presenter.
Childhood obesity is a complex issue influenced by various factors. Here are the main aspects. Definition. Childhood obesity is typically defined as having an exercise amount of body fat ratio measured using body mass index BMI for age. Increased consumption of high calorie, low nutrition foods and sugary beverage. Second point is physical activity. Sedentary lifestyle often due to screen time and lack of outdoor play. Third point is benefits. Family-free can increase the likelihood of obesity. The fourth point is long-term effect. Obesity in childhood often persists into adulthood, increasing the risk of chronic diseases later in life. Addressing childhood obesity requires a multifaceted approach involving families, schools, communities, and policy changes. Let's move to the next.
Hi, my name is Sharni and today I want to explain on child development issue. Child development issues encompass a wide range of challenges that can affect a child's physical, emotional, social, language, and cognitive development. Under the physical development issue, one of the issues is delayed growth or failure to thrive. Children are diagnosed with failure to thrive when their weight or rate of weight gain is significantly below that of other children of similar age and sex. Children that fail to thrive seems to be dramatically smaller or shorter than other children the same age. The second one will be premature birth-related development issues. Problems with the movement, posture, such as standing up straight and balance. The second one will be cognitive development delay. Under the cognitive development delay, one of the issues is genetic conditions. A child may inherit abnormal genes or a chromosome disorder. Examples include Down syndrome, Fragile X syndrome, or phenylketonuria, known as PKU. And the second one will be pregnancy conditions. A child can develop a cognitive delay as a result of injury during pregnancy or inability to develop within the womb. Natural conditions such as presence of drugs, alcohol, or infections can also cause cognitive delay. The third one will be birth conditions. A child can develop a cognitive delay as a result of problems during birth or labor, such as inadequate oxygen or prematurity. The last one is health conditions. Exposure to poison such as lead or mercury, malnutrition, inadequate medical care, and untreated disease or whooping cough can also cause cognitive delay. Moreover, for the speech and language development issues, development language disorder known as DLD is a language disorder that delays the mastery of language skills. Some children with DLD may not begin to talk until their 4th or 3rd year. Following speech development issue. Children who have trouble producing speech sounds correctly or who hesitate or stutter when talking may have a speech disorder. And following one is emotional development issue. Under the emotional development issue, children may go through anxiety disorders, a condition in which a person has excessive worry and feelings of fear, dread, or uneasiness. Other symptoms may include sweating, restlessness, irritability, fatigue, poor concentration, trouble sleeping, trouble breathing, a fast heartbeat, and dizziness. The second will be depression. Depression is a major depressive disorder. It's a common and serious medical illness that negatively affects how you feel, the way you think, and how you act. And the third one will be attachment disorder. Psychiatric illness that can develop in your young children who have problems in emotional attachment to others. The last one will be social development issue. Emotional regulation problems. Trouble controlling your emotions and how you act on those feelings. And the second one will be, and this is the last one. So this is all from me. Thank you.
Statistic of obesity, child abuse as signified, and lasting impacts on development, particularly regarding obesity. Research indicates that children who experience abuse or neglect are at higher risk of developing obesity. One key factor is emotional eating. Victims often develop unhealthy coping mechanisms that contribute to weight gain. Chronic stress resulting from abuse can disrupt hormonal regulation, leading to changes in appetite and metabolism that further increase obesity risk. Additionally, children who have experienced trauma may engage in less physical activity due to unsafe environments or physical barriers. The impact of childhood abuse can persist into adulthood, leading to serious health issues. Addressing these challenges requires integrated support system that focus on both psychological and physical health to effectively mitigate the impact of abuse on childhood obesity.
Hi everyone, so now I'm going to talk about the introduction of analyze and summarize of the chosen video. So childhood obesity is a major health concern worldwide which affects both developed and developing countries. The video Childhood Obesity Risk, How It Affects Your Child's Future explores its causes, risk and prevention methods. It highlights the serious impact of childhood obesity including physical, psychological, social and economic challenges. So now I'm moving on to the causes of childhood obesity. Childhood obesity causes many connected reasons, and unhealthy diets with lots of sugary drinks, fast food and snacks are a major issue because this food lacks of nutrients which can cause weight gain and poor health. So for the second one is sedentary lifestyle. This is because many children also spend their too much time on screen and don't move around anywhere. For example, like they don't play around and they just like spending most of their time in their house. So this will be the one of the cause that they may gain their weight. And which also and this issue is also added as childhood obesity. So for the third, I'll go for genetics. Genetics plays a role by causing to gain weight, especially if their parents are also overweight. For following, I'll go for the environmental factors. The environment also matters. Some areas that don't have enough
healthy food options or safe places to play around for children. So they will be like eating junk food and they don't even know like which food is which type of food is correct for them, which is for health. And the last causes are for psychological factors. Psychological factors including stress and emotional eating plays a significant part, leading children to seek comfort in unhealthy foods. Like these causes, like knowing these causes can help us to find ways to even prevent childhood obesity. So I'll move to my next example.
Hi everyone. So for now I'm going to talk about health risks from child obesity. Firstly, physical risk. Two types of diabetes: cardiovascular disease, joint problems, respiratory issues, and then psychological and social risk. For example, low self-esteem, bullying, depression, stress, and anxiety, and also following long-term lines, risk of adult obesity and chronic conditions like heart disease and certain cancers. After that, prevention strategies promote health eating, balanced diet with fruits, vegetables, and also whole grains. Next, encourage physical activities at least 60 minutes per day, and also parental involvement, role modeling healthy behaviors, and then school and community education promote nutrition and physical activities. And after that, health in interventions, regular checkups and professional guidance. In the end, childhood obesity is a complex, multi-dimensional issue requiring collective action. Physical, psychological, and social risks affect children long term. Lastly, emphasize on early interventions, healthy habits, parental involvement, and education is crucial to combat this epidemic. Yeah, that's it from me, and then I pass to the next.
Moving on to the next, which is steps and solutions to prevent the child development issue. The first one is physical safety and stimulating environment, which is providing a safe home for the kids to live peacefully, and first of all, providing the books and toys to stimulate their surroundings to support both physical and mental growth. For the second one is awareness and education, which is providing education. First of all, as the parents and as the caregiver, they should understand what is awareness of education. So maybe they're giving a support for the family who needs help, so that the family knows how to take care of the kids. Moving on to the next, which is parental control. As the parents, we should control kids' screen timing, which is giving them limited screen time using phones and also mobile gadgets and everything, so that they won't be so addicted to them. Moreover, we can avoid screen timing by sending them to physical activities such as badminton, footballs, basketballs, and so on. And next, which is healthy food. Providing healthy food to the kids will keep them healthy, and providing nutritious food will keep their brain active, and they will produce a lot of knowledges and thinking skills. And also, when the kid consume junk foods and everything, it will lead them to heart disease, cholesterol, and also blood pressure. And last but not least, manage stress. As the parents, we should teach the kids to how to manage the stress level, such as sit and consult with them, share their difficulties and everything. So, and also, parents can send